Evening, and welcome to New York City Health and Hospitals Fiscal Year 2025 Annual Public Meeting for the Borough of Brooklyn. Before we start the formal program, I would like to call your attention that we have language translation service available in Spanish and French Creole. If you require these services, please call 212 788 3359. Again, 212 788 3359. Thank you. My name is Dr. Patricia Marthone, Brooklyn City Council, Brooklyn representative to the Board of Directors. I want to thank you for joining us and would like to introduce the other board members who are participating. Dr. Vincent Calamia, City Council representative for Staten Island. Vanessa Rodriguez, City Council representative for the Bronx. Dr. Mitchell Katz, President and CEO. Also on the panel are Andrea Cohen, General Counsel and moderator for this evening, and Colicia Hercules, Secretary of the Corporation. On behalf of the board, I would like to extend our thanks and acknowledge leadership at our Brooklyn facilities. Sandra Sneed from Woodhull, Sheldon McLeod from Kings County, Svetlana Limpinskaya from South Brooklyn, and David Forbes Thomas from Susan Smith McKinney, and their dedicated staff for providing exemplary service to our public health system and the people we serve. And to all of you here, thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. Now I will turn the microphone over to the President and CEO, Dr. Mitchell Katz, to continue with his remarks. Thank you.
Good evening, everyone. I'm always very happy to be at South Brooklyn since I grew up about a mile away, and my family used this as our family hospital when I was a kid. I'm Dr. Mitch Katz. I'm a primary care doctor and the proud president and CEO of New York City Health and Hospitals. It's my 8th year in our system, and I'm very proud of all the people who work here. And I want to thank the staff and the community members who came out. The fact that you've come out shows that you care about our system, and we very much appreciate that. My goal has always been to expand access to care for New Yorkers, regardless of their ability to pay or immigration status, to offer the highest quality of care and advance our mission and values. This remains core to what we do every day at Health and Hospitals. Our nursing staff have had a phenomenal year. We hired over 3,600 new union nurses since March of 2023, replacing many agency nurses. And happily, many of those agency nurses agreed to come and be permanent nurses for us. We housed over 375 of our patients through our Housing for Health initiative. All of our hospitals have achieved at least 3 honors through the American Heart Association Get With The Guidelines and Mission program. We continue to be a leader in LGBTQ+ care. 4 of our hospitals, Bellevue, Elmhurst, Lincoln, and Woodhull, were ranked by U.S. News and World Report as high performing for uncomplicated pregnancy. Our groundbreaking lifestyle medicine completed its expansion, opening new sites at Elmhurst, Gotham Health, Vanderbilt, and Lincoln Hospital. We continue to provide services at our Asylum Seeker Arrival Center, which has welcomed more than 175,000 individuals from more than 160 countries. We are working hard to shrink our carbon footprint. New York City Care, our healthcare access program for people who are ineligible or cannot afford health insurance, celebrated its 5th-year anniversary with over 125,000 members. We have 20 new wellness rooms for our staff. Our arts and medicine program continued to beautify our hospital, and the new hospital has many great pieces from our collection. Our community health workers have worked with over 25,000 patients, and now we even have a podcast called The Remedy. Speaking specifically of some of the great things that happened in Brooklyn at Kings County, the hospital emergency department instituted a 24-hour patient advocacy, the dedicated team of bilingual patient representatives. The stroke center at the hospital passed its joint commission review. They established a support group called Consumers About Friends Family Education to provide a forum for individuals to share their recovery experiences. And Susan Ford was named a 2025 United Hospital Fund Excellence in Healthcare honoree. At South Brooklyn Health, where we are, we celebrated the opening of the Ida G. Israel Community Health Center. The robotic surgery program continues to grow. South Brooklyn Health received its full accreditation from the College of American Pathology. The hospital received accreditation of its dental department and national recognition as a stroke center, a baby-friendly hospital redesignation, a gold award for the stroke center, a lantern award for the emergency department nurses, a silver beacon for surgical ICU, and a gold plus blood pressure control award from the AHA and AMA. And at Woodhall, we've welcomed a new CEO that you got to meet, Sandra Sneed. We're very glad she's with us. Woodhall was redesignated as a baby-friendly hospital, recognized as high-performing in diabetes care, received the American Heart Association Stroke Gold Plus with Target Award, and the hospital achieved comprehensive center accreditation from the Metabolic and Bariatric Surgery Accreditation Group. At our Gotham sites, East New York renovated 12 of our behavioral health rooms to provide enhanced behavioral health care. Finally, I do want to address something that came up at our last borough meeting, and I know it's going to come up tonight. We love our nurses. Since the implementation of a new contract provision with our nurses union, we have hired, onboarded, and trained more than 3,400 nurses. We have had continued discussions with our partner NISNA about the handling of unscheduled callouts. And unlike a lot of organizations, we don't mind people disagreeing or discord. It's okay. It's a healthy organization that lets people express their views. It's all good. People who can disagree, friends can disagree, people don't have to see the world in the same way, and we welcome that. There'll never be any retribution to anyone for expressing their opinion, but we should not assume that everybody agrees with all things. We believe that there is on the issue, I can tell there are some passionate speakers who want to talk about why you think what we're doing is so wrong. But I also know there are nurses in our system who have felt that they have been left alone to care for a large number of patients unexpectedly because of a last-minute call-out. And that any nurse who has worked a 16-bed ward and expected 4 nurses there and found herself or himself there with 2 nurses has a hard job to do. And I don't think we have to pretend that that's not a hard thing. We do have to figure out what is a useful and important solution for this. We want to continue to talk with NISNA. We are talking about a policy that is 40 years old that provides for departmental counseling and warnings after multiple unscheduled callouts. And this takes place well before any discipline or penalties. There's nothing that we have said or will do or will ever do to say that people should come to work sick. We do not wish people to come to work sick. We have never punished anybody who was sick and stayed home. We want people to use their sick leave when they're sick. We have a very large number of call outs, and every person in every hospital will tell you that many people call out because they are sick at the last minute, and many people call out when they're not sick. And that is truth. And I think that anyone who believes that in an organization like ours, with thousands of employees, no one has ever taken one day off sick when they were not absolutely sick, I think that would be a hard thing to believe. So let's again, this is my opportunity. We're going to have, after this, I'm not going to be talking. Everything is going to be about hearing other people talk. We want to emphasize that we want people who are sick to please take their sick leave. We believe that with dialogue and negotiation, we can work out with NISNA what is a way to make sure that sick leave is used for when people are sick, so that we do not run into a situation where we have a large number of patients and we don't have enough nurses to take care of them on that occasion. So with that, we're going to proceed to the main purpose of tonight's meeting, which is to hear from all of you, including why you disagree with what I've said. That is totally fair and good. So with that, I'm going to turn to our general counsel to outline the proceeding for today's meeting.
Thanks, Dr. Katz. I want to move in. I saw some people join, so let me just say very quickly, repeat the point that if we have language translation services available in Spanish and French Creole, and you can call 212-788-3359 if you need those translation services. Okay. To begin with the framework for tonight. So this meeting in the Great Borough of Brooklyn is the third in a series of 5 meetings that we conduct annually across the city's 5 boroughs. The purpose of this annual meeting is to inform the public on the programs and plans of New York City Health and Hospitals, as you just heard about from Dr. Katz, as well as to afford the public and our employees, or anybody who makes up the public in this auditorium, an opportunity to present oral or written testimony about New York City Health and Hospitals. All of the testimony, anything that's said here tonight, which of course is being recorded and will be transcribed, as well as any testimony that you may want to submit in paper, will be forwarded to our entire board. But of course, we have great members of our board here to listen to this live as well. But all of the testimony that happens this evening will be transmitted to our full board. I'll be moderating for the rest of tonight. And I'm just going to lay out a couple of procedural points here. The most important point that Dr. Katz just alluded to is that at this point, the purpose from now on in this meeting is for the board to listen to all of you, those of you who've registered to speak, and not to engage in a back and forth, but it is your time to speak. In order for each speaker to have an opportunity to testify, and tonight we have about, just to give you a sense, we have about 25 speakers scheduled. So to give everybody a chance to do so and still let everybody go home and go to sleep, everybody will get 5 minutes of speaking time. There's a timer on the corner of this dais over here with lights, green, yellow, and red. When a speaker begins speaking, the light will be green. It will turn yellow when the speaker has 2 minutes left in their speaking time. At the end of 5 minutes, it will turn red, and in a few seconds, it will start to flash. At that point, if you haven't concluded, I will interrupt you, hopefully politely, ask you to finish your sentence, and then anything, anything that you haven't had, if by any chance you haven't had a chance to say anything, you can submit anything additional that you want to in writing, either right there or you'd accept it tomorrow too. So Please, though, we'd like people to conclude when it does turn red. I will be calling the name of people on the list in order, and the name and your affiliation that the person gave when they signed up. I will also then say the person who's going to be next, just the name of the person who's going to be next, so people can get into position and we can have a little less time between speakers. And with that, I will just say, some names on the list are familiar to me, some are not. If I mispronounce anything, please do feel free to correct me so that we know what your name is and how you'd like it to be pronounced. And with that, I think we will begin with speakers. And actually, our first speaker, the first person, we just want to acknowledge her presence in the room, not speaking today, is Debbie Medina, who's the Director of Outreach and Community Engagement for Congresswoman Yvette Clarke in the 9th District of New York. So just recognizing her presence here. But our first speaker is Roseanne DiGennaro. She is she's with the Community Advisory Board. She's the chairperson for South Brooklyn Health. And the speaker after that will be Lorna Chin.
Good evening, Dr. Katz and members of the New York City Health and Hospitals Board. I would like to thank you for giving me the opportunity to speak tonight. South Brooklyn Health, the Ruth Bader Ginsburg Hospital, is a state-of-the-art facility and has become the go-to place when you need excellent health care. This is due to our administrative team, Svetlana Lipinskaya, our CEO, Dr. Terrence Brady, our CMO, and Majinda Kaur, our COO. And of course, this couldn't have been accomplished without the caring and hardworking, dedicated team of doctors and nurses. It starts in our emergency room. We had 99,711 emergency room visits, making us the 59th busiest ER department in the whole United States. Many times the ER is your introduction to our or any health facility. I am happy to say that I have been told by so many who have come to our emergency room how pleased they are with not only the physical look of it, but by the treatment that they have received from the amazing staff at South Brooklyn Health. South Brooklyn Health now offers medical services and procedures that were only dreams just a few years ago. Our emergency room is just one of our many accomplishments. We provided 272,767 ambulatory visits. Outpatient radiology performed 137,432 procedures. We had 12,143 discharges. We completed 4,957 surgeries, 691 robotic surgeries, and 20 bariatric surgeries. And I'm happy to say that we delivered 1,414 babies. That's the best one. We opened our Ida G. Israel Health Center at its new location. The center will provide family medicine, pediatrics, and substance abuse services to those living in the western end of Coney Island. Construction is in progress for our Women's Health Initiative project, which will consolidate services. Our hematology, oncology, infusion center renovations are now in progress. The start of construction during the summer of our new ambulatory care space on the first floor of the main building. In the fall, construction will begin on the renovations to our dental practice. We are a certified stroke center. This past year, we treated over 200 patients presenting at our ER with acute strokes and successfully treated them with life-saving clot-dissolving drugs with an average administration time of 34 minutes. Because of these results, South Brooklyn Health's Advanced Primary Stroke Center is in the top 10% nationally for acute stroke treatment. Since 2024, we offered thrombectomies to our stroke patients who have a blocked vessel in the brain. We hope in August of this year to be reviewed by the Joint Commission to become a certified thrombectomy-capable stroke center. In 2020, we received approval and launched percutaneous coronary intervention at the hospital. This is a minimally invasive procedure that opens blocked or narrow arteries and can prevent a heart attack. In 2024, South Brooklyn Health performed 548 procedures. We have an average door-to-balloon time of 75 minutes. The goal is 90 minutes. We beat it by 15 minutes. Our cardiac cath lab is aging and needs to be updated and moved to another location in the hospital. We are asking our elected officials for this much-needed funding. A fully cath lab at South Brooklyn Health will provide immediate life-saving interventions such as angioplasty and stent placement for heart attack patients, improve patient outcomes by decreasing emergency transport times and ensuring rapid response to cardiac emergency. It also will reduce health costs by preventing costly hospital admissions and long-term complications. This additional funding will enable us to acquire essential equipment and ensure that our facility meets the highest standards of care while enhancing our hospital's ability to serve the most vulnerable members of our community. I also must ask that South Brooklyn Health become a level 1 trauma center. I ask every year, and this is something that the community wants and needs. The nearest level 1 trauma center is a half hour and even more than that in some cases away from our neighborhoods. Whereas the time to start life-saving treatment at South Brooklyn Health is half the time. We have many residents living in private, multifamily, and NYCHA buildings, and we have a growing population because of the number of high-rise buildings being constructed throughout our community.
And I
Not
ask
to
you just
mention
to
the
conclude
amusement
your remarks.
area from the spring, I'll finish, amusement area from the spring through the autumn with its extra 100,000 visitors. Going from one point to another is becoming horrendous because of the traffic. We know that the level 1 trauma center will take time and funding to sustain, but we desperately need it. Thank you for your time, leadership, and commitment to our well-being.
Thank you so much for your comments. Thank you. Okay, so the next speaker, thank you, is Lorna Chin, who is the chair of the New York City Health and Hospitals Kings County Community Advisory Board. And after that is Barbara Williams.
Good evening, everyone. Thank you for giving me this opportunity. At Kings County Hospital, we take pride in providing our patients the highest quality health care equipped with the latest technology, modern facilities, and an experienced board-certified staff. We continue to expand our services to meet the needs of the community. As a Silver Certified Center of Excellence in Patient-Centered Care, we are focused on partnership and shared decision-making. The implementation of the Patient Family Advisory Council helps us to think differently in how we show that we care. These efforts are reflected in the steady increase noted in our patient satisfaction scores. Some of our new services that directly impact the patients include the bariatric surgery, the hypothermia therapy, which is the head cooling of neonates, normally that were generally transferred to Bellevue, that now we're able to do that, which helps the family not having to travel. The other ongoing programs include CAFE, which is a Consumers About Friends and Family Education that Dr. Katz mentioned. This is a program that is not only for the patients that are the family members that receive care at the hospital, but it's also open to any other person that is interested in attending these meetings. They are held twice, once during the week and once on the weekends, and it's done virtually as well. We also have the CAVI, which is the Kings Against Violence Initiatives. We have the behavioral health fairs. King's Care is now a clinical forensic fellowship. This started probably about 2 years ago. They have graduated at least 3 physicians already, and it's an ongoing to lead to a bigger project, which they hope to start at the end of the summer. The medical and forensic clinical practice, that where they are having, it's a collaboration with not just the hospital staff, but they are other justice system and the other public, so it's to provide a care for these different encounters that patients receive. We continue to update infrastructure, policy, and procedures to meet regulatory agencies' mandates to ensure we meet best practices in caring for a diverse culture in a safe environment. We are pleased that the Community Advisory Board works collaboratively with the staff and leadership of Kings County to meet the needs of our community. Thank you.
Thank you for your comments. The next speaker is Barbara Williams, the chairperson for the Community Advisory Board at New York City Health and Hospitals Woodhull. And after that is Jacqueline Nareen.
Assalamu alaikum and good evening. Most of the people, they know my name, Abida Sattar, and I am working in this hospital from last 29 years. Voluntarily, I am social worker, and I start my work as a translator because I know three languages, Urdu, Punjabi, English, and little bit Arabic. First of all, I want to welcome all the guests and you, sir, because this is very important for our hospital to this meeting. And I want to say thanks to all my staff who are here and they're working very, very hard. And this hospital is a jewel in this community. Especially for my community, Pakistani and Spanish people, they are undocumented and they are very afraid to go to anywhere else. And I'm trying to convince them that go to this hospital, Coney Island Hospital or South Brooklyn Hospital is your own hospital. Nobody will bother you. Nobody will ask you, you have insurance or not. And I want to say thanks to my management. Okay, all right. Okay, sorry. So I want to say thanks to my management. They are give us all the respect for my community, and we celebrate Eid day, and all employees they are very happy. And I just want to introduce myself, and I am giving my time to the other speakers. Thank you.
Thank you. Thank you. Okay, we'll now hear from Barbara Williams. Are you here? Okay, who is the chairperson for the New York City Health and Hospitals Woodhull Community Advisory Board, and then we'll go to Jacqueline Noreen.
Good evening, members of the Board of Directors, Dr. Katz, President and CEO, and all other present at this hearing. My name is Reverend Yvette Luperena. I'm a member of the Woodhull Community Advisory Board, and I am filling in for Ms. Barbara Williams today, Chair of the CAB. Thank you for allowing the CAB to share some of our views at this public meeting. I would like to acknowledge the outstanding CEO of Woodhull Hospital, Mr. Gregory Killis, the new CEO, Ms. Sandra Sneed, and staff and my fellow CAP members for their dedication and commitment to improving Woodhull and providing excellent health care for the residents of North Brooklyn. The CAP is fully supportive of the vision of making Woodhull a model hospital and the hospital of choice for North Brooklyn, and we are fully satisfied with the partnership and collaboration with the leadership and the staff. I would also like to thank our community residents for their loyalty, trust, and their continued choice of Woodhull Hospital as their health home and the pledge of the hospital community and receive health care there so we may have a vested interest in ensuring the success for the benefit of the North Brooklyn community. Woodhull has made significant progress with access to primary care and reduced waiting time for appointments, which is comparable to private health clinics itself. We need to retain our providers and recruit new ones in order to further improve access to care. We understand that salary is a big factor, and we ask you to ensure competitive salaries in order to recruit and retain providers. We understand that we are providing more specialty services and serving significantly more patients in the ambulatory care clinics, and would like to ensure that quality is not compromised in doing so. The emergency department has been very busy, 85,000 visits annually. very busy itself, and we understand that current volume is close to pre-COVID levels. The new and improved extension to the ED is really greatly appreciated, and hope that the rest of the ED will be renovated also in the critical trauma area, which will create updated trauma-based nursing station and modern equipment in its progress, and appreciate your support for ensuring that this is accomplished as soon as possible. We also applaud the improvements in behavioral health during the past 2 years, which where much more permanent medical and nursing staffs have been added and all inpatient units have been renovated and reopened. We hope that these improvements are sustained and excellent care to this vulnerable population is continued. We also applaud the improvements in all the other services, including medicine, surgery, OBGYN, dental, ophthalmology, and the other specialties. Addition of other specialties mean less inconvenience to our community. Residents who can now get these services right here at Woodhull. Significant progress has been made during the last year in replacing temporary staff with permanent employees, especially the nursing unit and medical. We know that permanent employees are usually more committed themselves and take more pride in their work, which results in better care and experience. So we hope that this focus will also continue. The maternal deaths at Woodhull have caused much stress to patients, staff, and the community. Many improvements have been made to the maternal service, and we are truly hoping for stability and the resumption of trust in this area of our community residents. We understand the need for scaffolding during construction for safety reasons. The old scaffolding was up for over 10 years, and we were excited when it was taken down 2 years ago. We hope that the new scaffolding will be taken down on a timely basis once the current construction is completed. We pledge our continued support to the staff and Woodhull to ensure that the vision and the strategic goals are achieved. At this time, we would like to thank you all.
Thanks very much for the comments. Next speaker is Jacqueline Noreen, who is the chairperson for the Gotham Health Cumberland Community Advisory Board.
Point of order. Just wanted to, Ms. Noreen is here, but she was not supposed to speak. My name is Kenneth Beckett. I'm also on the list.
I see
And
that.
I'm supposed to be speaking for her, so I will.
Feel free. Okay, go right ahead.
Thank you for the opportunity for me to highlight some of Gotham Health's Cumberland's remarkable achievements and ongoing initiatives. Representing a team so committed to excellence in care, community, and impact is a privilege. We are proud to share that Cumberland has been named Millions Heart Champion, only one of 32 sites nationwide to receive this honor. This is a true testament to Cumberland's dedication to preventing heart attacks and strokes. Additionally, in 2024, we received multiple accolades from the American Heart Association and the American Medical Association. The AHA AMA Gold Plus Award for Hypertension Management, the AHA Gold Award for Cholesterol Management, the AHA Gold Type 2 Diabetes Cholesterol Management Award. These awards recognize the consistency and commitment of our clinical teams to evidence-based patient-centered care. Beyond clinical quality, Cumberland ranked first among all Gotham sites for the most improved performances across all metrics. This is a clear indicator that our momentum and drive for improvement. Financially, we ranked second amongst all Gotham sites, demonstrating our ability to be responsible stewards of resources. We're also investing in the infrastructure. Renovations are currently underway to integrate medicine and behavioral health services with remodeling expected to be completed by early next month, May, pending state inspection. Facility-wide improvements include painting, deep spring cleaning, and also help create a more welcoming and healing environment for our patients and staff. We acknowledge that some of our ongoing challenges are around wait times. Our leadership team is actively working to standardize clinical templates and improve scheduling flexibility to better accommodate same-day and urgent visits. We have another critical challenge, and it's access to mental health services. This is largely due to a shortage of providers. We would be incredibly grateful if anyone had any recommendations or contacts who could join or support our mental health team. We face a lot broader community challenges that affect our patients' health, particularly the unaffordable housing market and limited access to healthy food options. At Gotham, we're not just providing care, we're building a healthier, more equitable future for the communities we serve. Thank you for this opportunity to share our progress, passion, and pursuit of excellence.
Thank you. Thank you very much. Next speaker will be Deborah Tyndall, the Community Advisory Board Chair for New York City Health and Hospitals McKinney. And after that will be David Alexis. Go right ahead.
Good evening. On behalf of McKinney CAB and the staff, I will be mentioning to you notable accomplishments for 2024, 25, and some other. So throughout the year of 2024, McKinney had some outstanding successes. McKinney is the only nursing home in New York City to receive a 5-star rating across metrics. Newsweek ranked McKinney number 19 in New York State's best nursing homes. US News ranked McKinney best nursing homes in long-term care for 2025. Our wellness room was a welcome addition for staff who use it frequently to exhale and unwind. Finally, we were able to onboard a full-time wellness director in 2024 for staff engagement, which augmented the I Care with Kindness and Helping Healers Heal initiative. Strategic training was an added element that proved successful. McKinney's nursing department had major accomplishments. The initiative to increase recruitment and retention, especially with RNs, has been successful with significant improvement in rates. This has resulted in a considerable reduction in agency staff and helped maintain our 5-star CMS rating. The nursing staff were re-educated and retrained on the use of the new IV and PEG-2 pump. Staff also had specialized training on the use of the new auto pulse and AED machinery. The shared governance program has redirected some of its initiatives to include some forms of wellness activities for the benefit of the nursing staff. Even though McKinney has a wellness program, the shared governance initiative has ramped up wellness amongst themselves, especially in the areas of the reduction of stress to improve mental wellness, thus leading to better resident outcomes. McKinney is all about teamwork. Validation enhances the human spirit. So the nursing department has implemented a monthly in-house Nursing of the Month recognition program, where each month the nursing staff is recognized with a breakfast and a plaque. The therapeutic recreation department continues ongoing residents programming, such as virtual reality strolls, Parisian fashion shows, sip and paint, cooking with Chef Ali, Greentown vegetable gardening, Project, Spa Day in the Beauty Parlor, annual Caribbean Carnival where all costumes are made and paraded by residents and outings to baseball games. The food service department has added a successful fine dining component to the residents' dining experience. McKinney's rehabilitation department proves the highest quality of therapy with the goal of returning all residents to either their prior level of function or to their maximum potential so they can live functional lives. On this, on one of the department's miracle stories was treating a male for short-term rehabilitation. He was admitted with multiple injuries, which was obtained falling 40 feet while working. He suffered many injuries and was fearful that he might never walk again. At McKinney, he received physical therapy along with innovative modalities, and upon his discharge, he was a new person with a new perspective. And a month ago, he wrote a Google article, so you can look it up. Facility upgrades continue. We continue to work on upgrades for safety and comfort of residents and staff members in the following areas. New lighting project throughout the facility with LED lighting, controlled with adjustable lights, ID card access initiative throughout the facility as part of the safety McKinney improvements. The McKinney Auxiliary, who is under the leadership of Pearl John, has a positive and definitive presence at the facility. Have hosted various fundraisers throughout the year to raise funds for the residents. Mother's Day, plant sales are always our biggest hit. Each year, all women are given roses by the auxiliary. They donate winter coats, scarves, socks to the residents. They are a part of the judges panel for the Residents Labor Day Carnival Mass Competition. They co-host Residents Thanksgiving Dinner, Adopt a Resident Project, continuous visits to the residents, especially those without family members. Always present at the annual tree lighting and distribute holiday gifts to the residents. The only drawback about McKinney, we are requesting more visits from leadership from
And I-
downtown.
Can I ask you to conclude your remarks?
Yes.
We're at the final.
Okay, on a final note, I just want to thank Mr. Weinstein, who was our former leadership, was at McKinney. He brought perspective and to our facility. And I want to welcome Ms. David Thorpe Thomas as who served as Chief Operating Officer of McKinney Nursing Home since 2022 prior to her role. And thank you.
Thank you. Next speaker is David Alexis, Community Coordinator. Is David Alexis here? Okay. If not, the next speaker is Ina Castro, an RN with a nurse and member of the National Society of Leadership and Success. And after that is Yvette Delgado.
Ladies and gentlemen, good evening. My name is Ina Castro, Cancer Care from Kings County Hospital, and I'm the one in my nursing family occasionally advised by world leaders. We are simply here to ask each of you, what is the value of a life of one public city nurse to you? I would like to start off by saying I am a human being. I am a human being who is a nurse, but I am a human being first, nurse second. But when management sees me, I am multiple nurses in one. Infusion nurse, ICU chemo nurse, med-surg chemo nurse, nurse who works in a cancer clinic when there's nobody there available to work there, and the nurse who tries to fill in to help train the new nurse because there's no nurse educator. Because they have not yet hired one yet. But in the issue of me getting sick, we are simply watered down to less than one person. Because at the end of the 2 week, I get one paycheck and I accrue the amount of one annual sick day of one single nurse. We are in the business of caring for other people's well-being, but it makes me wonder who's got my well-being at heart. I recently got a lesson from another advisor who told me to be successful in this world, you should remember three things: value people, believe in them, love them unconditionally. I was also told you can't lead into a dim world, you got to lead into an optimistic world. President George Bush. The best kind of leadership is listening, as told to me by President Barack Obama. But it was in the urging of a third former leader of the free world who told me to always look around and try to learn as many stories as I can and imagine how their stories can be better and different. And he told me to view my own story and see how it can be better and different. And he told me after to then go about doing it. President Bill Clinton. Now, I'm considerably lucky because I get to be part of a humble group of nurses who are brilliant visionaries. Their cause transcends beyond the bedside and the four walls of the institutions we work in so that the world may stay kind, kind to the profession, those practicing in it, and kind to those who are at the receiving end of our care. And I'm lucky to get to say that in this lifetime, I get to be one of them. And that goes a long way since I get advised by an ever-growing list of influential people of this century. I'd like to talk a little bit about history. But first, I want to ask again, what is the value of one public city nurse to you? During the pandemic in 2021, during Nurses Week, it was a public bedside city nurse who was awarded the Alumni Award. That means out of 1.5 million current members of this honor and leadership society, the very honor went to a public city nurse. Yet why is it that I stand before you, a different group of leaders, and my very value may diminish in our workplaces? I hope wherever he is, I made John C. Maxwell proud about giving value to people. But I am here today because each of us know our value and we're here to assert it. I am a human being and I have value and an ever-growing list of leaders who believe in me and love me enough to give me a permanent seat at their table. Now, I'm currently injured, and in order to renew the permission for me to wear my braces, I have to get a letter from Equal Employment Opportunity Department. Sometimes there's a lag in its processing time. So during that time, I'm forced to stay home even though I'm not sick. Either use a sick day or annual day even though I'm not off. So there's only 3 avenues for me to use. Annual days, use FMLA. I tried to use FMLA intermittent. I was denied. I was told in the letter that it simply does not apply to me because I didn't use enough sick days. So the only means I can use to get to my medical follow-ups is to use a sick day. I already used 2 sick days, so you know where I'm getting at. I'm going to quote a letter from Equal Employment Opportunity Department. This office is responsible for reviewing requests for reasonable accommodations pursuant to the Americans with Disabilities Act and all other applicable federal, state, and/or local laws on behalf of H&H. Please communicate with this office if you believe the approved accommodation needs to be modified. This new sick day policy is not in the best interest of the public nursing body, my beloved nursing family.
Can I
President
ask you to
Katz?
conclude your remarks?
President Katz, I'd like to say to you, please accommodate me completely, accommodate me fully, accommodate me lawfully. Now that you know a bit about my story and our collective nursing story, I will ask for a third time. What is the value of one public city nurse to you? Thank you.
Thank you. The next speaker is Yvette Delgado, Reverend, and after that is Karma Augustin. Yvette Delgado. Okay. So the next speaker is Karma Augustin. Not here. Okay. Who is an RN from Lincoln Hospital. Christopher Grief, Corporate Secretary for the Brooklyn Family Support Service Advisory Council. And after that is Alia McKee, a private citizen.
Just for the record, it's Greif.
Grief. Thank you.
And now I'm going to have to call it Grief.
Thank you. I'll get it right next time.
as the one thing I want to be clear, I wear many hats as the secretary, correspondent secretary for the Brooklyn Advisory Council and the treasurer for the Brooklyn DD Council. And as some of you know me as advocate for people with disability and transit titles as well, which in Brooklyn, I'm the kitchen sink. Today, I'm here to talk about accessibility for people with disability, because thank God this hospital, they do love this hospital. And I'll use this hospital for an example. Yes, tomorrow I will be 42. As 32 years as an advocate, advocating for this hospital, I fought for this hospital and I'm going to still fight for this hospital. From the bus stops to the curb cuts, from the doctors to this building, to make everything fully accessible. Other hospitals, and I'm not going to say their names because I don't want to get shot, and because there are other hospitals, still need to understand we're in the 21st century, not the 20th century. If a person's coming in and has a disability and they have their caregiver or their advocate or their mother or their father or brother or sisters with them, and you want to keep them calm, work with them. Last time I checked, a person's disability is still a human being. We need to treat them. Doesn't matter who we are, what we are, but it's not just mental health. The word is disability or accessibility. We're not an R train, which I'm not using that word because it's a curse word, because we are people with all different types of disabilities, and there are called communication speech issues also. As the correspondent secretary for the advisory council and chair of the outreach, I have put on the record here that to make sure you guys have to know that in each borough you have is a Brooklyn DD Council that helps all types of disabilities, and they do meet. And in all the counties of New York has an advisory council. Deborah Greif, unfortunately could not be here tonight, is the chair of the Brooklyn Advisory Council and the statewide member for Albany for the statewide for Office for People with Developmental Disabilities. Abbreviation means OPWDD. Okay, and it's not mean RSVP, respect, no. The main thing is since I've been here for 32 years, coming here, standing here, and I have asked this question, what are we going to be doing talking about disability? Because when I see here, and I'm looking at this record, I'm so glad that South Brooklyn, Coney Island Hospital, Kings County, and I'll say the Brooklyn hospitals here, talk about accessibility for people with disabilities. But if I go to another county, I have not heard one word of a disability. I hear them getting abused. I hear that they don't get help. And there are nurses out there do help people with disabilities, and they need the education and help too. So how can we work together? The future of accessibility rides with us, not with trains and buses, everything. So we need to move on to the future. And don't worry, it's already on your records. So don't worry. So you don't need to worry everything. But I am encouraging the hospitals that all types of people with disabilities might get traumatized, get paralyzed, or the noise level gets high. There are times you just need to breathe and relax. If you want them to relax and calm, let's work together. We can't go backwards. We have to move forwards. If we go backwards, guess what happens? Everything here where we are standing will not exist. We need to move forward for once. And I've been in this hospital starting tomorrow will be 42 years. And people might say you don't look it. Well, it's because this hospital saved me. And I do advocate for everything, including the safety of the security guards, the hospital police, the staffs, because they work very hard and they do their job very well, how to work together. So I am asking, let's move forward for accessibility. Thank you.
Thanks very much for your comments. Next speaker is Alia McKee, private citizen, and after that is Tim Walker.
Good evening, and thank you for having us. Tim is my husband, and he'll be speaking after me. Last year, during this meeting, he and I spoke before you with deep concern about the Humanitarian Emergency Relief Center that H&H operated at 47 Hall Street in Clinton Hill, Brooklyn. At the time, 3,200 people, mostly single men, were being warehoused in an industrial building a block from where we live, a situation that caused hardship inside the facility, brawls, stabbings, measles, to name a few, which in turn added significant strain on the surrounding neighborhood. Today, we come back with a different message, one of gratitude. We know that H&H choosing to move away from operating mass warehousing shelters was not easy. It took leadership, courage, and compassion. We want to thank you for listening to the shelter guests and to the community and for taking compassionate action. Over the past year, all New Yorkers have lived through the complexity of a global humanitarian crisis playing out right on our neighborhood streets. This has never been about being anti-immigrant. As the daughter of immigrants, it has never been that. It was about confronting the real, layered challenges that arise when thousands of vulnerable people are concentrated in one place with no ability to work and too few resources. It required clarity, compassion, and willingness to adapt, and you showed all three. We are deeply grateful for your leadership, and we urge you with all of these situations and concerns to keep leading with the same creativity and courage you've shown us this past year. Thank you.
Thanks for your comments. Next speaker is Tim Walker, also a private citizen, and after that is Julia Savinkina.
All right, thank you very much. I'm here to really thank you for listening when, well, you can imagine if on your block one day there was suddenly 3,500 mostly single men speaking different languages showed up all of a sudden. We didn't know what was going on. No one had talked to us about it. And really, we couldn't get any answers or explanations. And we would hear about troubles happening inside the facility, like the men had no lockers for their valuables, so they would be always worried about theft. They had nowhere to hang out other than the children's playground because it was the only place with a bathroom outside. There were all of these problems and nobody would listen. Nobody would listen. And I would say that this meeting last year was one of the first times that some leadership said we actually want to hear what's going on and we'll give you a space to share that. So thank you for that. Thank you to Ms. Hercules, who helped with us finding paperwork on the contract that was done with RXR, and your great legal department who helped us with the Freedom of Information Act so we could get some information about that. And I think the biggest thanks has to go to your second in command of the Hercs, I believe, Chris Keeley. I don't think his job was specifically community liaison, but he brought together the NYPD, and he brought together us in the neighborhood and our city council member, and really convened us to try to make the best of what was a very difficult situation for everybody. So thank you for listening.
Thank you. Next speaker is Julia Savinkina. Did I pronounce that correctly? An RN.
Yes, you did.
And after that is
Hello, everybody. Thank you for the opportunity. Thank you for coming to us. So my name is Julia Savinkina. I'm RN, and I've been working with our organization since 2005. Glad to share all the opportunities, advances, and challenges that we had. And of course, today I'm here to speak about this controversial story about changing the sick, unscheduled sick call policy. So I was reading the official letter we received, nicely received from you, where you of course said, didn't acknowledge doing anything wrong and insist on the continuation of the policy. So I would like to object. There are different angles to look at this, so I will pick up only like really few. Also, you ask for examples. So one of the nurses approached me saying that she used 2 sick calls, and then she had COVID, which resulted in additional 5 days of calling sick. And therefore, she was canceled based on this. So it does sound really wrong to me. And physically, it is really impossible in 6 months to have only 2 days when you can be sick. And if you don't fall on this properly, then you will be canceled. Which is the first step. It's a punishment. That's how we perceive it. And it's the first step for elimination of the employment. So we perceive it as a threat, just to be very clear on this. So also you recommend us to use FMLAs. So, and I look into this from this perspective. I did some research, and NIH reports that nurses generally have more chronic conditions and worse health outcomes comparing to general public to begin with. So now they throw in few numbers, which obviously is just brief research. 82.4 nurses experience chronic severe episodes of back pain. So 79.1% of nurses have at least stress, depression, or anxiety. And I didn't even come to mentioning what is happening in our families with our family members. So combining all this together, we are coming to a situation that if it will take time for us to learn these tools, scheduled sick calls, intermittent FMLAs, but based on my research, almost every nurse might qualify for intermittent FMLA. Imagine if we learn how to use it, you will unleash Pandora box, which may result, I'm not saying it will, but there is a possibility based on statistics and research that if we have these FMLAs, especially intermittent ones, we will fail to provide any possible planned scheduling for the day. So kindly revisit this again, bring this back that 2 consecutive calls equals 1 occasion. When shouldn't be everything your way or our way, let's find some middle. Because when we work under stress, I wasn't here for 3 months, was on FMLA for my mom. So, but when I came, I see nurses are stressed. They feel that they are not respected at the same time. We don't work well under the stress. If you be nice to us, we make sure that our organization is thriving. So please kindly look from this angle as well. Because truthfully, if I say my nurses will be canceled for in these sequences, I will make sure make sure they will know how to use this intermittent FMLA. And I don't want to be a nurse who is doing something that can also, like be unleashing something that shouldn't be a war. Please don't unleash it. So just let's be middle way. Bring back this policy that we had before. Please, please, please. We are really pleading for you to do this. It's important because it creates a situation when we know that we are cared about, that we heard. And obviously, any abuse should be dealt with appropriately as it was done before. Nobody saying that it should not. But this is a too drastic change, which is physically impossible to fit in. Please, thank you.
Thank you for your comment. Next speaker is Mark Kent, an H&H patient. Mark Kent. Okay, then the next speaker after that is Desiree Peters, RN from H&H Kings County. And after that is Uwagbe Iwika, also an RN.
Good evening to everyone. As mentioned, I'm a registered nurse at Kings County Hospital, which was initially my dream hospital to work. Coming on vacation in this country, I was past Kings County, not knowing its affiliations. I said I have to work there. I had the opportunity, I was really, really happy. I stand here today with my fellow nurses to let each one of you on the executive team know we deserve our sick days. We chose this profession to get the people across our community back to some form of normalcy, or at least back to 100% of health. But instead, we are expected to come to work sick. On Saturday, we worked 5 nurses on a 36-bed unit with 8 step-down beds. I had 4 step-down patients, and I had to take extra 2 patients on the floor. I was exhausted. My body ached at the end of the 12-hour shift. I wanted to call out, but I remember that if I call out, maybe I'll be counseled, which to me is punitive. I came to work Sunday. Thank God we had enough staff. And staffing is a major issue. This is what you guys should pay attention to. How to retain your nurses. How to keep the young nurses. They don't want to work hard. I'm an old-time nurse. I've been in nursing for over 15 years, started from my country. I know what working is. I know what hard work is. But new nurses do not want to work hard. Okay? So the pressure I can work under, they would not. I remember one time being in charge on the med-surg unit. An agency nurse was assigned. I made the assignments and she had a patient. Doing my rounds, I noticed the patient had a Foley catheter. The bag was very cloudy. I said to the nurse, can you please get an order from the doctor to get a culture done or some, the urine sample? And she said, I don't have time for that. I drew back. I was like, what do you mean you're assigned to the patient? Agency nurses, we, the staff nurses, we, the permanent nurses, we work. We deserve the sick time we occurred. Dr. Katz, you are a physician by profession, right? You know the incubation period, the pathophysiology of simple thing as the flu, right? The incubation period is up to 4 days, yes? Transmission for up to 10 days, am I right?
Yes.
Okay. So just by me speaking to a patient with a simple face mask, because we don't use N95 unless we have like a transmittable respiratory problem. A simple face mask, right? I can sneeze and the little pathogens can fly out and my patient can become sick. No, I was informed on multiple times, multiple occasions, that the sick time was interpreted before 3 to 1. And that was for more than 30 plus years, right? Out of the blue in 2025, you, the executive team, is telling me and my fellow nurses that is now 1-to-1. How does that make sense? In the last public meeting I attended, it was shared that the nurses at Metropolitan earned the Gold Beacon Medal for the Gold Beacon Medal, and the ER earned the Lantern Award. Nurses, nurses, nurses. We are the first in line of contact in every healthcare setting, from the ER to inpatient. We are in direct contact 24 hours a day, 7 days a week. Nurses and nursing aides are at very high risk for becoming sick. We deserve our own sick time. So you're saying to me that I should be a robot? Like I have an off button, on button, that I can switch on and off when I feel like I cannot. I'm a human being just like the patients we have at the hospitals. When I feel sick, I should not be able to turn it on or turn it off. Like Sunday, I could have called out, but I did not. I thought about my patients and my colleagues. I worked. You're also saying that I should not get sick, and if I do, I should come to work, because when I use all my sick days in one occurrence, I have nothing left. My paycheck will be cut. I have bills. I have a life. Now picture this. I come to work sick. What's going to happen to my patients? They can become more sick, and who wants that? Not me. I do not want that for my patients. You're also saying that over the past 30 odd years, management and HR have been interpreting the sick time absolutely incorrect. You cannot fool me. All right? Take a moment and think about this. This decision will not only impact me, it will impact other nurses here, but also importantly, it's going to impact our community. Think about the people who generate the money in HHC. The nurses do, the doctors do, the aides do. The patients cannot take care of themselves. I am making a public appeal to the CEO and to all the executive members to be considerate, be compassionate, be empathetic. Something that you expect from me, I expect from you as well. Thank you.
Thank you. Next speaker is, and help me if I get the Uwag Bay Awika, an RN from NISNA, and after that is Ray Briggs.
All right, good evening. I'd like to start off with an email from Dr. Katz that you sent on March 18th. Subject line, your well-being is our well-being. And it reads, March 18th is Health Workforce Well-Being Day, a nationally recognized day dedicated to raising awareness about the importance of your well-being. This important day highlights the widespread burnout and mental health challenges faced by healthcare workers every day and promotes our initiatives to support your well-being and foster a culture of support and resilience at NYC HHC. In recognition of Health Workforce Wellbeing Day, Helping Healers Heal is facilitating a virtual panel featuring system staff members who are dedicated to workforce wellness. This email was on March 18th, the same day as the previous meeting. Your response to our need to appropriately use our accrued sick time is the direct antithesis to this email and the program Helping Healers Heal that HHC prides itself on. There is no, in the beginning, before, right when you started, you mentioned we can agree to disagree. There's no agree to disagree here. I'm sorry, like it's a cop out and it's a very poor one at best. We deserve the right to use our accrued sick leave without fear of retaliation and disciplinary action being taken. In addition, there's no excuse for management's continued union busting efforts, illegal retaliation for staffing complaints, and denial of our rights as union employees. One of the issues resulting in unscheduled sick leave use, which is what it is, it's unscheduled sick leave. Please don't just frame it as call-outs. It's sick leave that we work hard for and that we're entitled to. It's occurring because NYC HHC's inability to retain new grads. To segue, new grads on every unit. I work in the emergency department, just so that everyone knows. Our new grads are being burnt out while on orientation, specifically the component of direct patient care. The previous installation of orientation included approximately 2 months of med-surg unit experience, which now substituted for online modules and simulation labs. They're given now approximately 6 weeks to master competencies, which is virtually impossible to do. They're being burnt out. It's not that they don't want to work hard. They're being abused. They're being spat on. They're being bitten. They're being punched. They're being kicked. All these things are universal to our experiences. I've been at HHC for 2 years. I've been exposed to COVID, TB, RSV, flu, MRSA, CRS, everything in the book. All right. I've been verbally abused by patients, by their families, by other staff members. Granted, it's important to understand that we're one union, we're one family. We show up every day giving everything that we have, especially our two most valuable commodities, our health and our time. We give everything that we have to our jobs, and we show up every day giving everything that we have. We do our jobs, do yours.
Thank you. Next speaker is Ray Briggs, an RN from South Brooklyn Health. He's also the local bargaining unit president. Next speaker after that is
Dr. Katz. Dr. Katz. Good. First, I must welcome you guys to the island. Welcome you guys to this is not Hans Island by any chance. The Enter the Dragon, those who are familiar with that movie. This is a very nice island. Very nice, very accommodative. The nurses are very hospitable. And we like to roll out our red carpets to all the rest of nurses here from other institutions, fellow sister institutions. Thanks for coming. Thanks for supporting us. Dr. Katz, I'm your friend, and you said friends must disagree. I agree with that. But friends don't lead other friends wrong. And sometimes if you take off your glasses, you might see more than one Dr. Katz at your table. I have a problem with that, Dr. Katz, because somebody has sold you a Trojan horse. Somebody is trying to undermine your leadership. Somebody's trying to take your office. According to Machiavelli, good leaders surround themselves with intelligent people. But whether it's a good leader or a foolish leader, they must be aware of the fact that there comes a time when somebody believes that they can usurp that leadership and take command and take control. That's why we have coup. That's why we have replacement of governments. That's why we live in a world of uncertainty. And I'm going to tell you this, it bothers me sometimes. When you got up and you said you know nothing about this when it first came out, it really hurt me because I felt that you have undermined and you have gutted the confidence that nurses had in you. And therefore, as my friend, it's not time to look in terms of dollars and cents. It's time to look at where your vision would lead you and what you want for our institutions. For instance, this institution, we don't have a library. I was asking for us, we have something like a jailhouse library, if you know. You could go check it out right around the corner. Go check it out. The next thing we don't have is a nurse's lounge. We could have recliners. Nurses need to put their feet up. We need to do that. We have a little room, they call it a break room. That looked like a jail room to me. Yes, Dr. Katz, I can go down the line. We talk about a sim lab. We're a teaching hospital, and young nurses never touch a dead body, never. They don't even know where to find the heart in the body, so maybe if you ask them for the liver, if the liver is on the left side or the right side, they might not be able to tell you. They need to see for themselves. They need to, even if it's a sim lab, to come close proximity to the real thing. They can have an idea how to treat diseases and so forth. But I know time is of the essence. But what I really want to say is this. We have a situation with retention, really and truly. Retention and cost of living. That's our problem. This is where our problem lies. And our salary, suppose we have some mock something, some par or something, whatever it's supposed to be, is not enough to sustain a nurse in terms of this profession. Nurses are looking for alternatives to survive. Nurses have family. On the backdrop of that is in terms of bonding, maternal instinct, family commitments. And those are things that, as a human being, a nurse will have to choose whether they come to work at H&H or they stay home. The thing that I learned in the military, they told me, God come first, you come second, and anybody else come third. That's where a lot of human pride, how a lot of human beings prioritize the situation. Look at the ED, for instance. ED, we've been battering the ED for staffing, because the fact a lot of the young nurses leave. They are being overworked. And I know when an ED nurse told me that when people from central office came around, they moved nurses from wherever it is and they put them in that department to shop the sector. Which is okay, you can do that. I like that. It's a clever idea. But overall, in terms of the money that the facility makes, as you see the numbers that roll out in terms of patient care, it's on the backs of nurses. And therefore, nurses are not buildings. Nurses are not AI technology, Nurses are a human being. And we have to understand there's a better way to doing it. And the better way of doing it, we have to look in terms of nursing education, time to go to school, time in terms of the retention bonuses. We have to revisit that. We also have to revisit, maybe have in-house nursing master's program so people can be attracted and committed to working. And if possible, an overall general idea of what their economic conditions are at home so we can look at the next bargaining session to make sure that our nurses are properly compensated. Because we're going to go drug this, go wrong or wrong. So but that case, I'm going to leave it here to tell you that it bothers me to know that you have been given a Trojan horse and come back to bite you. And I hate to see that happen to a friend of mine. So be very wary of the people you surround yourself with. Thank you.
Thank you. Next speaker is John McShane, who's a RN also from NISNA, and after that is Christiana Ung. John McShane? Yeah.
Good evening, board members. My name is John. I'm a nurse at the Kings County ED, and I'm a NISNA member. I spoke at last month's meeting at Gouverneur about the pride I take in working for H&H, the pride I take for working for a public institution, the admiration that I have for all my fellow coworkers at King's, and the dismay I have over this policy change to our sick time. When I spoke at the last meeting, I was hopeful that it seemed like all of you were listening intently and taking to heart what dozens of nurses were saying, that this change to our sick time policy is unfair, unjust, and dangerous for patient and worker safety. That's why I was extremely disappointed to read H&H's response to our union from Jonathan Wengel, dated April 1st. In the letter, Mr. Wengel says H&H shares our concerns that, and then this part is bolded and underlined, employees not come to work when they are sick. Unfortunately, that's where the humanity of the letter ends. The tone then shifts to emphasizing the uptick in unscheduled callouts, redirecting the blame of the staffing crisis to the very healthcare workers who work under immensely stressful conditions to heal New Yorkers from all walks of life. The letter says the quiet part out loud. H&H management wants healthcare workers to feel like it's our fault that we're forced to work in extremely unsafe and stressful conditions, rather than taking responsibility for adequately staffing our city hospitals. This blame is placed without any investigation into why there may have been an uptick in unscheduled callouts. Healthcare workers who worked through the pandemic are still coping with mental health effects. Our hospitals are more full, and our patients are often more sick than in the past, and nurses are working intense days. Like other nurses who spoke before me, there have been days where I've worked multiple days in a row, had more than 10 patients every day, had no ancillary staff because they're all sitting on one-to-ones, had to work through breaks, and I think, how can I go back to work tomorrow? On top of all of that, I have to worry about getting called into the office if I need to call out sick. When you work in care, like in a hospital or a school, it's really easy for your boss to make you feel guilty for taking care of yourself, especially when you work in a public institution, which is all too often underfunded. You give everything you have for a job that you love and the patients or students that you care for, and then you're blamed for not giving more. It feels pretty clear that's what's going on here, and it doesn't feel okay. The letter from Mr. Wengel also tries to have it both ways, and I've kind of heard this here tonight too, admitting that there is some sort of policy change taking effect, but at the same time respectfully disagreeing with NISNA's claim that there has been a change to the interpretation of 20-10. This is because the letter asserts that warnings and counselings do not constitute punitive discipline per se. I would like to ask the board members, if you were working on the floor of a hospital and a bunch of your managers came to take you off of the floor, bring you into an office in the back, and castigate you for calling out sick, wouldn't you feel like that's some form of discipline? Even if it's not formal discipline, could these warnings and counselings be used to build a case for future discipline? It seems clear that this whole policy change serves to place more power in the hands of management to keep us nurses in line. If managers can selectively threaten us by calling us in the back and counseling us just for being sick, not only does that shift the blame to nurses for the staffing crisis, it can also discourage us from filing POAs and complaints with the State Department of Health to draw attention to this crisis and apply pressure to fix it. Dr. Katz, I appreciate you for bringing up this issue in the introduction to tonight's meeting, and I'm hoping that you and the rest of the board members here tonight really take to heart what we're all saying. We ask that you and the management of our city's hospitals take responsibility for for staffing our hospitals adequately while taking into account that healthcare workers get sick and that there will be unscheduled callouts. We would like to have the right to use our sick time that we've earned and that is stated in our contract without being blamed. Thank you.
Thank you. Thank you. Next speaker is Christiana Ong, an RN from South Brooklyn Health, and after that is Sarah Dowd.
Thank you for the time. My name is Christiana Ong from South Brooklyn Health. I'm working in MedSearch department. Today I speak for MedSearch, but I'm sure this could apply to other department as well. Working as a nurse, I realized the part where we unfortunately get the wear and tear part of the job. Most nurses, especially who work bedside for more than 5 years or even less, have at least one of or more problems, either with chronic back pain, chronic knee pain, other medical issue, or even mental health problems, either diagnosed or just showing signs and symptoms. I'm just working here shy 12 years, and sadly, but I'm not shy to say that I have almost all of those problems, and it starts from working as a nurse here. And it got worse for me after getting the first COVID shot. I started having problems with my both arms until today. I still don't have strength to raise my arms freely and still not able to move my arms without feeling pain. It even prohibits me from having a good night's sleep. And yes, I'm still working together with my CNA, my coworker, and other nurses doing patient care using up these weak arms. The worst part, I cannot even do a simple task like scratching my back. This is the farthest I can reach. I'm not able to do that like further than this anymore. And Dr. Katz, there were days I came to work with so much pain throughout the shift and kept working. Sure, sometimes I'm complaining. I complain and then talk too much in the unit basically. But there are times that I have to keep my mouth shut because of the pain. It's like very much troubling me. It's better to keep my mouth shut than complaining because of that pain. But sometimes the pain itself so unbearable, and it is impossible for me to function properly at work. Or sometimes for other people, I said other people because I haven't been using this excuse at all yet, hopefully never. They might call out for mental exhaustion because sickness is not just about physical only. We are exposed to work with sick people, and the possibility of getting sick is unfortunately unavoidable. Being not allowed to get sick and getting counsel for being sick is harsh. Where is the compassion that being preached all the time? Yes, you said that we are not being penalized, but it doesn't seem that way. Getting sick 2 or 3 occurrences where one occurrence consists of 2 to 3 days, because some of us working 8 hours, some of us working 12 hours, should be acceptable. Only allowed to get 2 days sick within 6 months is harsh also. It's so difficult. We are human beings who's only able to prevent, but we'll never know what could happen in the next minute of our lives. One thing I know, if God forbid one of us die while working on the job, we'll be just a TKID in this place. Sad, but sure. Again, Dr. Katz, last month actually I joined with the NISNA, Nurses in NISNA Group Union to send an email to you, a letter to you. And I said, when a nurse is forced working while sick, patient safety is jeopardized. It's negatively impacting mental health and morally. It's hurtful to the staff, the company, and mostly the patient. Physical fatigue is draining and exhausting. However, mental fatigues are always, mental, emotional, and mind fatigues are ways more damaging. Please reconsider the policy that pressure nurses to work sick when we could have a healthier body and mind to work together as a team for better purposes. With all power and authority given to you as our leader, please do all you can to keep the previous interpretation of the time and attendance policy as before, without staff getting disciplined for being sick. nurses should not be pressured to come to work sick. Thank you so much.
Thanks for your comments. Next speaker is Sarah Dowd, RN with NISNA, and after that is Pauline Wallace.
Hi, I'm Sarah. I work at Kings County Hospital. Today, April 29th, is my birthday.
Happy birthday.
Yeah. I'm 36. I know I look much younger. I've been a nurse for almost 10 years. I brought some family with me because I really wanted to be with my family today. But I'm here, with you, because this is really important. This is really bad policy. It's hateful, and most importantly, it doesn't solve the problem. We start off short-staffed. I've been to these staffing meetings. I work in a 10-bedded ICU. We're at goal with 4 nurses. So that math doesn't really math, right? Because we have 10 beds. The ICU ratio should be 1 to 2. You have 4 nurses. It doesn't work that way. We need 5, okay? If we get 10 patients, you're short. So, I'm sure that this is not new information for you. I think you know this. And so if you're chronically staffing short, you're making the nurses sick. And what I'm hearing in your response today is even more disappointing. It's like you want us to trust you that this is only going to be thrown at people that are really, really, violating the counseling policy. If they're already violating the counseling policy, why do you need to change it? And I think furthermore, it's like the ADNs don't work that way. The management doesn't just say like, okay, it's only 1 extra, I'm not going to counsel you. Even though you're really vocal and you fill out protest of assignment all the time, you're getting counseled. It's retaliation. That's what happens. And I know that can't be new to you. That can't be the first time you've heard that. So I'm just going to sum up by saying that this, it needs to go back to how it was. We need it in writing. And if you're fighting against the nurses, you're fighting on the wrong side.
Thanks for your comments. Next speaker is Pauline Wallace, an RN at Kings County, and that's actually, Pauline, you are the last speaker.
Hello, everyone. Good evening, Board of Director, Dr. Katz, my fellow nurses, especially my Kings County nurses. Okay. I have been working at H&H for over, I started to work at Lincoln in 1997, and I transferred to Kings County Hospital in 2000. All my children were born at Kings County. I love that place. I will not work any place else. But over the past years, I was never counseled. Granted, I'm not a person who call out sick unless I'm sick, but I have never experienced or was told, I was always told that 3 equal 1, always. So I was surprised when it came up now that it's gonna be 1 to 1. So I am just here to ask the board, ask management to leave 20-10, the interpretation, to be 3 and schedule sick call equal 1 occurrence. Because what I'm finding with the newer nurses, the younger nurses, and we are working 12-hour shift, flex shift. So in a month, if you accumulate 3, maybe 12 hours of sick time, or some people only have 40 hours. So what I'm saying is, if you get sick and you're out for 5 days, and it's 1 for 1, imagine many of these nurses won't have any time to cover up. That's one of my biggest fear, and I would like the young nurses to be more involved. They are the future, and when I leave this place, I would like them to be well educated about the rules and regulation of this place. I would like them to be able to seek be sick and not worry about, oh my God, I have to come to work. You know, one thing that hurt me the most, about 4 weeks ago or 3 weeks ago, I went on a unit just to see how the nurses were doing. And I observed this young nurse at the end of the hallway, like with her mask on and coughing. So I was curious. When she opened her mouth, she could hardly talk. So I said to her, why are you at work? She said, you know, I had the flu before and I used up 2 days. So I'm afraid to use the second day, the third day, if I'm gonna get counsel. So I told her you should have go to the ER, talk to the ADN, get a note and go to the ER. But you know, our nurses, our young nurses need to be educated, and it's up to us, the older folks who are still here, to let them know what is going on and to let them know that you are entitled to get sick. I am not saying you're going to abuse your sick time, but you are entitled to be sick. And I would appreciate it if the board, the rest of management, and everyone who is involved at the corporate level down on Water Street, you know, just to bear that in mind, that we are the backbone of the healthcare system. We are the first responders. We are the people who keep the doctors going. We work hand in hand. So we need to work together and we need to retain 3 equal 1. Thank you so much for listening to us.
Thank you. We do actually, I believe, have one more speaker. This is a speaker who was not here earlier, David Alexis. Are you here? David Alexis, a community coordinator. Come on down.
Hello, thank you for giving me the opportunity to share my piece, and I'm going to keep it tight because I know that there's been a lot of testimony today, and I'll add the remainder in written format. But I'm the name is David Alexis. I'm here representing the Commission on the Public Health System. We are a community-based organization that has organized with NISNA, nurses, and many community organizations and coalitions to improve health access and equity in underserved communities all across New York City. This continues and remains to be our mission. And one of the things I just want to add that I may not be able to just capture in the testimony I'm going to write is the fact that myself, as the son of a nurse who worked in a psychiatric hospital, as someone who lives in Central Brooklyn and relies on hospitals, Kings County, and in the part of Central Brooklyn where we have a public epidemic of a healthcare crisis in these communities, particularly around maternal health, early childhood, infant mortality and whatnot. I want to say that in order to really address the needs of the community, as someone who relies on health and hospitals, as someone who works with other organizations and whatnot, that we really absolutely need to support and invest in the critical infrastructure that takes care of us as the community, and a big piece of that are our nurses. Safe staffing is actually a really, really important piece. Literally, my wife has sickle cell disease. She was just admitted into Kings County about a month or so ago. And literally one of the biggest issues that she encountered during the crisis and being admitted for a couple of weeks was just a little extra access support for nurses. And again, because of the cuts that have come down through no fault of just the folks here, but with everything that's been going on, a lot of the pain and the issues that she encountered were expanded. Literally, just to be, she came in with a port. It was difficult to find someone who could access the port. Literally, she ended up getting stuck about 10, 15 times for each time there had to be just blood drawn to just do the basic, blood tests and whatnot. And what we ended up having to do was having to just stabilize her and go outpatient to kind of get her transferred over to what ended up being at Brookdale, where she usually sometimes also goes to finish the part of her treatment. And for me, Health and Hospitals is a public hospital. It is a hospital that, when all else fails, that we as a public need to be able to rely on. And even though, sickle cell is not the most common disease, we still have a community, particularly in that part of Brooklyn and parts of the Bronx and certain parts of Southeast Queens, where we have populations that are heavily relying on our public hospital system to get by. And I think that of all the things that have been talked about today, it is incredibly important that attention to the support of our nurses and a lot of these other pieces around the programs about dealing with folks like sickle cell and other folks is really important to meet this need. So I'll add the rest of that in my testimony, but I appreciate all of the attention and the effort that can go to address this. Thank you.
Thank you. And that concludes our program for tonight. Thanks so much for being here, and get home safely.